In the vast landscapes of Kazungula district, where access to healthcare remains a challenge, a small health facility stands as a pillar of resilience. This is Sikachapa Rural Health Care Center, a place where dedicated health workers battle against odds to serve their community. On March 17, 2025, the FDI team, accompanied by DAP, arrived in Sikachapa to assess the malaria prevention efforts and elevate the voices of the community. The CLM Malaria Project, spearheaded by Charles and supported by the Global Fund, partners with civil society organizations such as FDI and DAP to address the urgent need for rural healthcare investment. In a focus session, the FDI Programs and Partnerships Advisor, Mr. Felix Ngosa, read out the findings of the assessments, analyzing the current situation and strategizing on ways to strengthen malaria interventions and improve service delivery in the region.
Then yellow needs improvement, red needs adaptation. At the end of the class, there's a key. So where there is green there, you can just read green, you don't have to read through. It's an area where people are happy and you meet expectation as a facility.
Later, a community dialogue meeting took place where local residents voiced their concerns and hopes for a better future. They highlighted gaps in the malaria prevention, such as the absence of insecticide-treated nets and ICE materials, and the lack of indoor residue spraying since 2017. They also spoke of Joma River being impassable during the rainy season and leaving patients stranded. Additionally, they raised concerns about the lack of reliable transport for referrals, making it difficult to access the high-level care during the rain season.
Okay. So it's a challenge because we don't have any transport at our facility. So we have to call those from the hospital. So it's a big challenge for the transport to come. It needs time. So,
because of the road?
Yeah, the road is bad.
Local leaders, healthcare workers, and volunteers shared their first-hand experiences, stressing the need for sustained support and urgent action to address the pressing issues.
Arimi turumbawiti ori sirutagora arimi gabajituisya wani mulimbote degu kuri kwabirira kuri malaria arimi ambotwere degu tubayisi abantu ko twarumba kuri gago ona jimwi cyo turumba nchaguti ibridge inajoma imamota oroyaninze yibwe sabantu ya health yagari toredwa amazi ari kurombesa maningi kuti eri bridge ari teni.
Looking at the challenges that people are facing, because malaria has been one of the major causes of morbidity in the below 5 and the 5 and above.
On March 18, 2025, FDI, accompanied by DAP, shifted their focus to the district office, where they met with the district commissioner and key health district workers. Together, they discussed the concerns of Sikachapa's residents and explored solutions for enhancing healthcare and malaria prevention.
Together, we see the gaps, and that gaps are going to inform programming of those for future intervention. Without these quality control measures, it will be difficult. We'll be just doing business as usual, and we'll start seeing cases going up instead of going down.
The district commissioner, who was fully aware of the community's challenges, shared his commitment to finding solutions.
We used to have a lot of challenges that even when mosquito nets are distributed, we still have malaria prevalences in Katongwa, in Skaunzwe, in Mambova, in Sikachapa itself, in Momba, in Wombwe. So these areas where I want to call it was a mess, because every intervention was put, but quite often and then we used to have those prevalences.
Following the key stakeholder engagement at the Kazungula District Office, a few voices shared their experiences, shedding light on the challenges of malaria prevention, the dedication of community volunteers, and the collective commitment of strengthening healthcare at the grassroots level.
The gaps that have been identified surrounding malaria delivery service are actually expedited, and the intended solution, the intended results are actually achieved.
Kuya kuli zetu chitazinjanji kujatikizia malaria ngo tuide kusoleka ku control kuti amane malaria. So tulabereka kuya awa bam partners bakatujoina wa FDI.
Interventions, they are coming from the community themselves, and see how best we can help to end the malaria in our catchment area. So we give thanks to FDI. We say may they continue helping us. Also try to identify more problems that our community are facing, so that at the end of the day we can able to reduce malaria in our community.
True change requires a collective effort of everyone: government, civil society organizations, health workers, and the community. Together, we can make a difference. As the flag flies high at the community facility, the spirit of the people of Skachapa remains unbroken. Now is the time for action.